Hey everybody, it's Jessica here, and welcome to another Q&A Wednesday here on Jessica Smith TV. This week, we're introducing something extra special, and it's called our Ask the Expert series. So I'm going to be asking some of my favorite health and fitness experts to come and talk to us to help answer all of your questions. I'll be the first to admit I don't have all the answers, but I'm happy to find them out for you. So stay tuned for this week's episode, which focuses on back pain. We have a fantastic expert. I can't wait for you to meet him. Just a quick heads up, we are recording this in Skype, so you might need to turn your volume up a little bit more. And this session is going to be a little bit longer than our typical Q&A videos because it's chock full of fantastic information. So be sure to stick around for the entire session, even if you just want to leave it playing and listen to it while you go about your daily activities. Thanks as always for tuning in, and please be sure to leave me a question in the comments below and let me know what experts you'd like to see here on our channel and what kind of questions I can ask them for you. Thanks for tuning in, guys, and I'll see you next week for another Q&A Wednesday. Hey everybody, thank you so much for tuning in to our special Q&A Ask the Expert series today. I'm so excited to introduce you to Dr. Yoav Suprun, who is a McKenzie therapist and back pain specialist. So I'm just going to start the interview off, Dr. Suprun, with just asking you if you would tell us a little bit more about yourself and your background, and just give us a brief explanation of what the McKenzie method is.
Hi everyone. First of all, thank you, Jessica, for inviting me. I'm happy to share my knowledge with you all. I started my career as a personal trainer in 1995, and fairly quickly I realized that I am not able to help a lot of my clients who have pain, whether it's lower back pain or pain that radiates into the buttock or down the leg into the foot, what's called sciatica. And after getting frustrated for a while, I decided I have to study the body better. Went to NYU, did my doctorate in physical therapy, and when I graduated at NYU, I had my knowledge of the body and much more than I had as a trainer. And then I went to work for one of my professors who introduced me to the McKenzie method. Robin McKenzie unfortunately passed away last year, but he was voted one of the most influential people in orthopedic physical therapy. And the premise of the method is to teach the client, to teach the patient to adjust their own spine. So creating less dependency on the practitioner or the doctor or the surgery or the medication, and more knowledge and empowerment of the client or the patient that is working out, trying to stay fit, trying to stay pain-free, and yet all these aches and pains are coming, as we all know, so often after our routine, whether it is after a spinning class, after a Pilates class, after yoga class, when you do CrossFit, whatever it is that we're doing, playing tennis, playing golf, most people have aches and pains. And the McKenzie method focuses predominantly on patient education, how to fix their own aches and pains, whether it's lower back pain and sciatica or stiffness and pain in the neck that radiates down the arm. All these are common spine problems.
Great. Well, thank you so much for that intro. And I'm just going to get right into the questions that we had prepared for you that we're hoping to get your take on and the McKenzie methodology on. The one being that we often hear that strengthening the core can help with preventing or treating back pain. So is there any truth in that?
So that's a common theme going on in the world for many years now. And what we know for sure as a fact, that no matter how much you strengthen your core, if you don't know how to sit properly, in other words, if you slouch for a prolonged period of time on your laptop, or you watch television in bed with your legs spread straight ahead, or you are bending forward multiple times, which is called flexion, the core is not going to stabilize the vertebrae or the discs. Let's take a look for a second. We have a spine right here, and the spine has natural curvatures. Actually, let's look at a real spine. This is a life-size spine, and you can see the spine has specific curvatures. In the lower back, it's called the lumbar lordosis. Here is the left buttock, this is the right buttock, and now I'm turning it towards you. So if you strengthen all those muscles, which can assist in supporting you, but yet most of us during the day, we don't maintain good posture. We so often spend excessive amount of time bending forward and flexing our spine. And when we flex after 15 to 20 minutes, there's a phenomenon called creep, C-R-E-E-P. What creep does is it lengthens the ligaments. So we can see here we have two vertebrae and a disc between them. This is the spinal cord. These are the nerve roots that are coming off the spinal cord. The ligaments in the back are back here. If I slouch for a prolonged period of time, what's going to end up happening is disc material is going to start bulging. When disc material starts bulging, can you see this, Jessica?
Yeah, we can see that. It looks painful.
It is. So what you often start to feel when the disc bulges is you will feel stiffness. You'll get out of your car or you'll get out of your office chair, and as you're trying to straighten up, you will feel something mechanically blocking you. A lot of you, as you start to walk, will start to feel better. Some of you actually, as you start to walk, you may limp for a while, or you feel buttock pain, or maybe even pain radiating down the leg. And often as you continue to move, it gets better. So again, it's a question of not only strengthening the core, but knowing how to maintain that lumbar lordosis, that curvature that is so important to prevent injuries from occurring in the lower back.
That was a great explanation. Thank you so much for that. So
Sure.
that's one thing we've already learned from this interview. So the next question that we had was that we also often hear that exercise such as yoga or Pilates can be helpful to those with bad backs. Is this the best form of exercise for those with pain issues?
So one important thing, there's something called directional preference. What is directional preference? Directional preference is movements and positions. Let's say you have sciatica. You can see in this figure here pain radiating down the leg. And you take a Pilates class, and when you leave the class, you actually have back pain and not leg pain. That class is appropriate for you. Although it sounds strange that you leave the class with back pain, but you came with sciatic pain, you're actually putting less pressure on your nerve root, and that class is appropriate for you. Same thing goes if, let's say, you do a yoga class, and you came to yoga, and you had back pain, and maybe when you were in child's pose or downward facing dog, you start to feel the pain leaving your back and radiating down your buttock or down your IT band, even into your calf. You're actually getting worse as this is going on. So what we do as McKenzie therapists, and you are welcome to view the McKenzie Institute website, it's mckenziemdt.org, and we are all over the world in 27 countries, and obviously in the United States we have a very large representation. What I recommend for people to do is to go through a mechanical assessment to find what exercises are appropriate for your specific problem. So the magazines often say one thing, and the journals and the articles are saying another thing. What's important for you is to know that you're an individual that needs that specific attention. So maybe at the end of the class, when everyone tells you to roll up one vertebrae at a time, you may need to do some extensions of your spine to set your back into place. And remember, back pain is not a bad thing. It's when the pain leaves the back and radiates down the leg is when that class injured you. And right now I'm treating a lady who started recently a spinning class, and when she leaves the spinning class, she feels that her leg is literally weak. It's hard for her to basically walk back to her car. And as I investigated what she's doing during the day, she is a graphic designer, and she sits hours designing in front of a computer in poor posture. And to add to it, she's slouching on the bike for another 45-50 minutes in a class, which again propels the discs that we have in between the vertebrae to migrate backwards. So This material that starts to migrate backward, you can see it right here, is starting to come close to the nerve roots, and that may start to feel stiff in your lower back after class. But if that jelly actually touches the nerve root, you will start to feel pain leaving your back and getting worse down your leg. Okay. So again, it's important that you will have a mechanical assessment to determine what's your directional preference, and that will help you determine whether you should do spinning or elliptical or running or yoga or Pilates, etc., etc.
That's great. So it's really in line with, the message that we have here on Jessica Smith TV, which is everybody is different and everybody has different needs. So, just saying overall that yoga and Pilates is good for the back may not necessarily be true for everybody. So thank you for clarifying that point for us. I think that makes a lot of sense.
Sure.
Great. So, talking about workouts and everything, we are a group that likes to work out often. Are there any exercises that you recommend to help prevent back pain or strain?
Absolutely. So after we evaluated you, the majority of people respond very well to what's called extension exercises. Extension exercises are exercises that actually move your spine not into flexion but into extension. The opposite direction of flexion is extension. Now, let me show you a picture of the difference between flexion and extension. So right here we can see that there is this figure here, and that figure is bending forward. When we bend forward for a prolonged period of time, as we talked about before, we can eventually cause a bursting of the ligaments and this material to migrate backwards. If we extend our spine, we can push this material back in. Now, extending one time may be painful. There's a transition before you can extend your spine fully. There is a transition of specific movements, such as lying on your stomach first for 5 minutes, propping on your elbows, going back on the stomach, and then doing something like what's called the cobra in yoga, arching the lower back. Some of you have tried it and it hurts. But if you do it slowly, obviously after a correct mechanical assessment, if you do it slowly, you will often find that your range of motion into extension starts to increase further and further with repetition. So one repetition may not be beneficial. And if you're an extension responder, if you like to walk, if you're better on the move, if you're worse when you're sitting, like sitting in a car or sitting in your office, you need to add into your program some extension exercises. So an example of daily activities, all these activities are flexion. Making the bed, sitting in the car, gardening, cleaning the house, sitting in front of the computer, even doing crunches are flexion. Sitting on the bike. These are examples of extension exercises that might be very beneficial for you, but we first have to make sure that extension is your directional preference. If it is your directional preference, opposite arm and leg. Introduction of extension on the reformer in Pilates classes. So say to the instructor, I would like to facilitate more or add more extension exercises. Can be done both on the reformer or on the Cadillac. Can be done just with your exercises, Jessica, that are body weight, bands, light dumbbells. For example, anything we do, if we sit all day in an office, we should do bicep curls standing. We should do lateral raises in standing. Shoulder press in standing. Less sitting. There's a new phrase that is often used now, sitting is the new smoking. And actually it was on CBS a couple of months ago on Charlie Rose, that sitting is considered very harmful for the body. So a lot of my patients are now getting, for example, high-low desks. They're switching from 45 minutes of sitting to 45 minutes of standing. We need to add more activities that will allow us to age without being hunched forward. The reason a lot of us are aging forward, or our parents are aging forward, is because we spend hours, about 3,500 times a day, we move our spine into flexion. And if we flex all the time, and we don't balance the flexion with extension, what's going to end up happening is the discs in the spine will migrate back, and that stiffness that we often feel as we get up will start to become worse and worse until we cannot stand erect. And it's a choice. Everyone could and should age with good posture. And so the choice of exercise has to be a balance between both flexion and extension exercises.
That's great. And that's really something that, after working with you several years ago, I started trying to incorporate that into my workouts. And typically I will end a workout with several extensions just to help balance things out. But as you said, it's also important to get your individual evaluation to find out what's right for you. But that's definitely something I've tried to incorporate more into my workouts, knowing that most of us are spending so much time rounded and hunched over. And I wanted you to know that I'm doing this from my standing desk right now. So I've got the standing desk down and I love it. It's making a huge difference for me.
Standing desks are today one of the best sellers in the ergonomic world in the field of designing your workstation. A lot of banks and accountants and lawyers that I work with are starting to understand that sitting for a prolonged period of time is really hurting them. So I salute you for standing and working in standing. That's so beneficial for our spine.
It is, especially since, we can't erase all that with an hour at the gym. We think, I sit all day, but then I work out really hard for an hour long. But it's really about everything you're doing throughout the day. So those are great points. Thanks so much for sharing that. So I think you sort of touched on this already with what you were saying, but are there any specific form tips that you could give us or exercises to include in our workouts? When we're doing things like bent over rows or moves from a forward hinge position, is there anything we can do to balance that out other than the extensions? Or
so the important thing again to remember is if you have lower back pain and you're doing bent over rows for tricep extension, let's say, and you feel that it's holding the dumbbells is putting strain on your lower back. So there's two ways to adjust. Number one, you may want to, first of all, you always want to keep the hollow in your lower back as much as you can. You do not want to do any of the exercises where your lower back flexes or arches. You want to keep the buttock back and you want to keep the arch in the small of the back. In addition, you may find it's more beneficial to lean with one arm and do one arm at a time, because it takes some of the weight, some of the fulcrum that goes onto the lower back, so that can be beneficial. Furthermore, if you notice that those exercises bother your back, you may benefit from a couple of extensions prior to the flexion, and after the flexion exercise, after bending your trunk, also try to do 5, 6, 10 repetitions of extension to see if you can eradicate or abolish your back pain. A lot of the time that will be beneficial.
Okay, great. So incorporating the extensions prior to the exercise and then just after and see if that helps. Correct. If you experience pain. That's a great tip. Thanks for sharing that.
Sure.
And now I actually have some really fantastic questions from our community members here about some specific things that they're dealing with. So we'd love to get your expertise with them. The first one is from Taylor, and she wrote, "My back has a few nasty knots everywhere. Should I just do constant yoga and stretching to help make them go away?"
So a lot of the time, that's an excellent question. A lot of the time, those knots, those muscular spasms, people associate the spasm in the back often with muscular problem. What the research shows and what we are finding is a lot of the time it comes from a mechanical disturbance in the resting position of the spine, meaning the vertebrae and the discs are not sitting where they should sit, and then the nerves can get pinched. And the nerves provide electricity to those muscles. So if something interferes with the flow of electricity to a muscle, that can cause muscle spasms. It's very common to feel the upper trapezius radiating down into the shoulder blade. A lot of the time, people keep squeezing on those muscles, and it's actually often not the muscle that is the problem, but the position of the neck. When you fix the neck, those muscles calm down. When you fix the spine, the same thing occurs. A lot of the time, if we correct the alignment of the spine, how the spine sits, how it rests, the pressure comes off the nerve. And so if those of you that are watching us right now experience leg pain that behaves like muscle spasms, whether it's in the back or you're feeling it down the leg and you constantly want to stretch the muscle, those spasms that you're feeling are often nerve related and not muscle related. So we feel it in the muscle, but it's coming as a result of something that squeezes on the lumbar nerve roots. So again, if we understand you well and we move you in the right direction, those muscle spasms should disappear. You may experience some increased central back pain. That's a phenomenon called centralization. You're welcome to Google it. Centralization of back pain is an excellent news for those of you who feel spasms or muscle tightness down the leg and you're doing specific exercise and the pain moves towards the center of the back. It actually tells you that you have very good prognosis, that there's a very good chance within a couple of days you'll be able to abolish your problem completely. So again, it's not always the muscles. You got to look first into where the joints of the spine are, and when we fix those joints, most of you will not feel muscle spasms.
That's great. So she should really get an evaluation to find out what's out of alignment, what's out of whack and causing those knots.
Right, and the best way again is going to McKenzie, MDT, Mechanical Diagnosis and Therapy, MDT.org. You click on the United States, you put your zip code, you'll see for patients, and then you'll find a McKenzie therapist next to you.
Great, and I'm including the link in the video description below so they can just click directly on that as well.
Oh, yes, and they can get all the links also from my website, sobispine.com.
Perfect, great. Well, thank you. Let me get you another question there because I know we're tight on time. So we have a few more. Aura wrote, my mom hurt her back several years ago. She had a herniated disc, and her doctor said she had to strengthen her back muscles. What kind of exercises can she do?
So, one thing I would wonder first is does she have any osteopenia or osteoporosis in the spine? Because, for example, someone with osteoporosis can actually hurt their back if they introduce flexion exercises. So, when I deal with the older population, one of the most important exercises, let's put it this way, the most important exercise in the world is walking. All of us should be walking about an hour a day, if not more. The body was meant to move. Obviously, we all have jobs and we all, it's hard to find time to do it, but we need to move. Even if you can move your mom a couple of times throughout the day, if she can go for a 15 minutes walk 4 times a day, that's something beneficial for the spine. In addition to it, as far as strengthening, I would do functional strengthening exercises. For example, even standing on one leg as you brush your teeth can engage your core, can help stabilize it. Because if I collapse completely now, nothing works. But if I brush my teeth standing on one leg, I'm starting to engage some of the muscles that support the spine. And you can do it both morning and evening, 30 seconds on one leg, 30 seconds on the other leg. I would promote the ability to sit and stand, which is the second most important exercise in the world. We sit all day and then we need to stand up, but we never do repetitions of it. Obviously, as the exercise with you, Jessica, we all do squats, but we don't practice it during the day. So another important exercise to add is sitting on a chair, getting up 10 to 15 times. Do it a couple of times a day. You must maintain, and your mom must maintain the ability to spring up from a chair. So many people, especially the baby boomers now as they're aging, are finding it's harder for them to get up, harder for them to extend the spine, and often that can be eradicated if the exercise program suits your needs.
Well, that's wonderful news. We are huge fans of walking here on our channel, so thumbs up for walking and for squatting, even though we may love to hate to do our squats. So that's good to know. Thanks so much for sharing that with us. So hopefully, Aura, that helps you and your mom a little bit. And then I just have 2 more questions for you. Allison wrote, I sometimes get pain in my lower back and never know if I should use ice or heat for relief. The answer seems to keep changing. Thanks all the way from Sydney, Australia.
Oh, from Sydney, Australia. Excellent. So that's very close to where Robin McKenzie started his clinic. And Robin always used to say, whether it's ice or heat, what's important is to put the joints of the spine back together. So we all know when we sprain the ankle, we're supposed to rest, ice, compress, and elevate, rise. With the spine, the literature shows that either can work. Those of you who benefit from ice or feel better with ice, stick with that. Those of you who have more of the chronic issues and you feel better with the heat, you're welcome to use that. What's most important is, after the application or heat or ice, make sure your lower back is maintained in the correct position. So let's say you're lying in bed and you applied ice or heat, but then you go and watch television in the living room and you slouch in your chair. That will again make the back angry. So I would recommend to use something called a lumbar roll. A lumbar roll, when we sit on a chair, can often help place the spine in the correct direction. So you sit all the way in, and then you lean into the lumbar roll. That will support the whole, that will support the lower back. A bunch of our viewers are doing it in their car. They like to have some support in the car seat. You're probably an extension responder, and that will help you more versus hot or cold.
I love it. I have one of those in my car too. I always use it for long drives, so I highly recommend the lumbar roll. I can attest to its effectiveness. So that's a great answer. So it's really, again, this is more about personal preference, but the most important thing is that you're realigning your spine and dealing with the issues that are causing the root of the pain.
Exactly.
Great. So one last question here for you. So this one comes from Joni. Oh, I'm tired. I have two more. Just kidding. They're really great. I saved the best for last. We could talk to you all day. Okay, so this one is actually from Sherry, and she says, doing floor work for abs gives me a sore lower back. Is there a proper way to do the exercises that I'm missing? I've stopped doing crunches and sit-ups or leg lifts because I always have a sore lower back afterwards. Fortunately, standing ab work seems to work pretty well for me, but I'm curious about floor work for abs.
Okay, so that's very interesting. So standing ab work are good, but when she lies down, you're feeling lower back pain. So that again goes together with what I discussed before, and that is often when we lie down to do crunches. So here's the spine again, and now the buttock is right here, and I'm crunching. And as we do those crunches, again, we're applying pressure on the front, on the anterior part of the discs, and that pressure over time can cause a migration of disc material backward. Not only that, again, remember, we are flexing our spine. Try to think how many times a day we do all these activities. The average person bends their spine 3,500 times a day.
Wow.
And then we age towards the walker or towards the cane in a flex posture. So if you have back pain and then you do a lot of crunches and you start to feel more pain, what that is telling you is that your spine isn't sitting in its most appropriate position. And then your lumbar lordosis is disappearing. That hollow we talked about in the small of the back disappears as you crunch. If you love to do crunch and you must crunch, I would recommend doing crunches on the ball, or take a towel and put it in the small of the back prior to doing the crunches. But remember, before and after crunches, you should try some extension exercises. And I explain all the extension exercises that are appropriate for most of you in the DVD I did together with Robin McKenzie. It's called Treat Your Own Back. You can find it on Amazon or on optp.com. And we explain how to slowly start arching the back without hurting it. And in addition, sometimes planks will be a great core, or side planks will be a great core exercise if you want to challenge your core without squeezing that jelly, without creating excessive force when you bend forward that pushes that disc material backwards. So stabilization while planking. You can plank on the ball, you can plank with one leg up in the air. All these are beneficial exercises.
Great. And I think it's just so in tune with our message of keeping a balance, you know, in your life and in your body, because like you're saying, we're doing all this forward flexion, but we don't have the balance of the extension exercises. So it's no wonder that we experience pain when we're doing more forward flexion. And it's just really about finding that personal balance between your daily activity within your workout and finding a way to really make it work for you. And it's interesting because proper form in crunches is actually there's not supposed to be that much rounding of the back. The upper back has a little curvature to it, but truly you should be keeping your pelvis parallel to the floor, so it kind of takes some of the lower back curve out. So you know, I think the addition of the ball or the towel underneath the back, like you mentioned, is a great tip that can really help prevent some of that pain. So thank you so much for that. Okay, so this is our last question, I promise. So this last one here is from Joni, and she had a question about lower back strengthening exercises. She says, they always hurt. I have a touchy lower back anyway. Should I just work through them? Will I reach a point where they don't hurt anymore? For example, lying on my stomach and then lifting my upper body hurts. Lifting it and then turning it really hurts. At what point do I know that the exercise is not one I should do versus trying to work through it?
Okay, that's another excellent question. And the Mayo Clinic had a test on one of the important exercises, especially for osteoporosis, is actually the one Joni just mentioned, lying on the stomach and doing an extension. Now, if you have a deranged back, if you have a spine that is not situated correctly and does not have the good support of the normal curvature, and you initiate those exercises, if you pinch the spine too quickly, it will create pain. So there is a process of slow moving, for example, moving from a prone position, just lying completely on your stomach for a couple of minutes, and then moving from this position to this position. So from lying prone to lying prone in extension, and going back to this position a couple of times, alternating before you do anything that will extend your spine. That will often help. Again, you must be, or you should be, assessed mechanically to see what is the problem exactly. But the majority of you, whether you watch it on the DVD or you see a McKenzie therapist in your town or close to you, will see that it's not just execution of the exercises quickly. There needs to be a preparation of the spine prior to doing those exercises.
Great. Those are great tips. And I'm going to also include links to the book and the DVD in the video descriptions for our viewers so they can get more information. And do you do any consultations via Skype if anybody wanted to work with you?
I do, and if someone would want to do some Skype consultation, they can email me directly from my website, which is SobeSpine, S-O-B-E, SobeSpine.com, South Beach Spine. I'm here in South Beach, beautiful South Beach, Florida, and I have clients from around the world. I have another office at the world-renowned Canyon Ranch on Miami Beach, and so I see patients that travel throughout the world, and be happy to help any one of your viewers to help them with their problem.
Great. Well, thank you so much for sharing all of this wonderful information with us. And thank you so much to our viewers for tuning in. We really hope that you found this helpful. And don't be shy. Reach out if you're having back pain. Contact Dr. Suprun. Get the book. Get the DVD. Learn more about your body so that you don't have to live with pain and you can keep moving pain-free. Thanks so much for tuning in, guys, and we'll see you for another Q&A Wednesday soon.
Thank you, everyone.